Okay, so we've started the recording, and again, I am Mark Tiesmeyer-Hook, owner of Align Athlete. We are the creators of the Glute Activator. This alignment hour is a benefit that we give to our purchasers of the Glute Activator to be able to take the techniques of the Glute Activator and master them, and also learn some of the side techniques that help the glute activation to work better. And today we're talking about the basic technique of how to use the glute activator to get the most out of it. And secondarily, some of the other things that are involved in lower back pain. Lower back pain is a little multifaceted. In fact, there's three things today that we'll talk about that affect people's lower backs, and we'll talk specifically of where the glute activator comes in and helping with that. With that, let's go ahead and get started. By the end of the session, I will open it up if anybody has specific questions about their own alignment. I'm happy to have you come on camera and ask me specifically what you could be doing in your own alignment practice that might help you specifically. And it's very individualized to everyone. So if you're just joining, we are recording this session for posterity and to help others. So again, if you want to stay off camera, I understand. But let me start by talking about the glute activator specifically and how you should use it, and some of the features of the tool that can help you better understand what it's trying to do. So first and foremost, I want you to notice there are some ridges, some circles that are on this. It is meant to go over clothing, and we left those ridges there sort of like sandpaper in order for it to grip your clothes and be able to move the sacrum bone without sliding on the clothes like that. Secondly, it is meant to grip the sacrum. And we found that if people can get it into the right place, they can do a lot of good. And one of the most common things that people might do somewhat incorrectly is they put it a little too high or too low on their spine. So let's talk about exactly where the sacrum bone is. If you reach behind your back off to the side, so here's the center of the back, there's actually a little bit of a divot right about there. That is the top of the sacrum. And for most normal, not high waisted or low waisted pants, it falls right about at the waistline. So if I had a belt on, it would be here. The sacrum top is right there. The tool touches the top and goes center to the body right there. We get a lot of questions. Can you use the glute activator in standing? Um, and the answer is kind of yes and no. If you place it on your body in standing, you can grip your sacrum and you can do a little bit of mobilization through the spine, through the hips, and it is doing some good. But because we have muscles of the glute max, that's the big butt cheek muscle, and down underneath it, the piriformis, and above it, these muscles of the spine, all connecting to that bone. When we're standing, they're all kind of activated, and it's harder when they're in a slightly contracted state to get the sacrum to move into its normal position. So the correct technique is to lie down on your stomach. If you have any problem just being in that lying down position, you can put a towel roll underneath the hips, and a lot of times that helps. You're going to lie down, put your cheek down on the floor, and let me know if the microphone stops picking me up. I always get confused on which side of the audio works. Cheek on the floor one way or the other way. Grab that tool, place it on the top of the sacrum, and then you want to just anchor down with a very, very light pressure. We don't want to shear the sacrum down toward the front of the body. Just hold it in position and then push toward your feet. Again, with a pretty light pressure. I tell people you can't really force your sacrum into the position, into correct alignment. You breathe it into position. You let the tool just relax the sacrum into the right place. And so with 8 to 10 deep breaths, and I do a head turn midway through so that the paraspinal muscles on both sides of the neck get stretched, you will find that that levels the sacrum out. We have people who get up from that and they say, I can tell the difference. It's miraculous. And we have a lot of people who say, I don't feel anything. So let me teach you 3 basic tests that you can do before and after to show that the tool is working for you. The first one is a basic glute max test, and that looks like this. If you lie down on your stomach, same position as you're using the glute activator, head turned, and then you bend a knee and you lift toward the ceiling. That knee should go straight up as opposed to this, which is showing that the glute is not working so great if your leg has to turn across your body. But straight up like that, you look at your mobility on this side and you look at your mobility on this side. And if you find that both of them are a little bit inhibited, that's a time to reach for the glute activator and push down the same way I just told you, but also a little bit of rotation of that lower edge into the sacrum. Breathing, relaxing. And you'll find coming out of that, once you get that lower tip of the sacrum to settle into your body, generally the mobility through the hip is much, much better. Secondly, sorry, I'm facing away from the camera. You take your foot and you pull your other foot inward and you test how much strength this leg has to resist that push. And if you find that you don't have a ton of strength on that side, but you do have a good amount of strength on this side, that's a sign that the sacrum is like this. A little bit up on the left, down on the right. The weak side tends to be the side that the sacrum is tipping into the body. The strong side tends to be the side that the sacrum is tipping out of the body. So another technique, and these are covered in our YouTube videos, is to take the glute activator and push down specifically on that strong side. You're leveling the sacrum out and helping it to make the hip rotators work better. Now, if you can't remember this and you just use the basic technique, 80% of the time it does the trick. So that's why we call it the, sort of basic technique, because it's a pretty good shotgun approach to fix things. Finally, the other muscle test is pushing out. And this is less common. Usually people are pretty strong on this one, but occasionally you'll find one leg moves more than the other leg on that push out. And that's a sign that the sacrum actually can be a little bit, here, I'll get a little closer to the camera, a little bit like this. It's clockwise or counterclockwise rotated. And the glute activator will work on that as well. It's a little harder to show this on camera, but essentially you can push down on one side and pull up on the other once you've got it into position to unrotate. And play with that, because it's not always consistently that you have to push the left side down or you have to push your right side down. You test before and after, and you see where the strength, which motion helps the leg to be stronger in that outer push. That's a real crash course on 3 techniques, or really 4 techniques. The basic technique, the tip of the sacrum out where both legs are weak in glute extension. The one leg is weak on internal rotation or external rotation, or the leg is weak on internal rotation. Those are all covered in our YouTube series and in a better, longer descriptive detail than I just covered. But I want to point you to our YouTube channel and use those resources. When I check my clients, or when I've checked clients over the last decade, I find almost in everybody, the sacrum is slightly rotated or flexed or extended in just about everybody. And we're walking around with that happening. And the effect of that is that our glute muscles are suboptimally working. It's not a problem until it is a problem. So you push yourself on a run, maybe you're on trails and you need that stability through your hips and your knee is just not stable or your leg's not stable because your glute's not firing well. Or you push yourself, going on a hike where you're climbing hills and every time you take a step, your pelvis is doing this. So it leaves you with lower back pain. It's something that I think we can do just as a little bit of preventative maintenance on our bodies to align our sacrum every day. And it's, for the most part, painless, and it only takes about a minute. Next, and by the way, at the end, I will ask anybody if they have specific alignment questions. But look, I said that I would cover basically the three things that cause lower back pain. So I've got a whiteboard behind me, and my penmanship is terrible. So let me just tell you that right away. But if this is a pie chart, lower back pain is essentially three pieces to the pie. There is the pelvis, there is the sacrum, and there's the lumbar spine. Monique, can you move the camera closer to here? Thank you. It's a little tangled up there, but I know you'll handle it. At our sacrum, this is where the glute activator is doing its magic. I apologize to everybody that this marker is probably way out the door. So the glute activator is fixing this piece of the lower back situation, but it's not addressing the pelvis and the lumbar spine. And I was very acutely aware of this because we work on lower back pain in our training practice at Better Living Fitness, that I was bringing a tool to market that was covering 1/3 of the equation. There's no tool that's going to do all of this at one time. However, there's some very simple muscle energy techniques where you use your own muscle to correct your pelvis. And I taught that in my last alignment hour last week. There's also some pretty basic techniques that you can do with a foam roller to fix your lumbar spine. I cover all of this in my class called the Lower Back Reset, which is currently discounted $131 on our website. So if you are still experiencing lower back pain, even though you're using the glute activator correctly, you may benefit by getting your pelvis and your lumbar spine into the right place as well. The three things all working together are pretty powerful for getting your body into a nice fluid alignment that we tend to lose as we don't mobilize and end up moving in sort of an asymmetrical pattern. Really interesting. Remember when, I don't know if you went through this, but it was traumatic for me, going through grade school and then having that day where they check you for scoliosis and you have to go down the hall to the bathroom, take your shirt off, and have somebody run their fingers down your spine. I remember it acutely, but 3 to 5% of kids have a scoliosis. But over our lifetime, when we recheck people in their later years, say 70 years and older, 68% of people have a scoliosis. And our theory at Align Athlete is because we have a pelvis where one side's forward, one side's backwards, it's no longer a stable base. One leg's a little longer than the other. The sacrum has shifted. The glutes have weakened on one or both sides. The lumbar spine has done a bit of a shift, a dance, and then what's going to happen is the whole spine is going to accommodate so that you can still look forward. And you'll look at people in a crowd and one shoulder will be higher than the other. Their shoulders are dipping like this. Their hips are off to one side. Their feet are often turned out. These are things that we are addressing by doing this little bit of maintenance on our body. So, what I say to people who get up from the floor from using the glute activator and say, I can't necessarily tell a difference, no worries. As long as you're not in pain from doing it, essentially, it's doing a little bit of maintenance on your body, kind of like brushing your teeth is each day. Right. That was my lesson for this alignment hour. Um, Please, if you feel comfortable, come off or unmute yourself or raise your hand if you can't unmute yourself, and Manit will help you to raise your audio. But if you'd like me to look at your alignment or talk to you about your specific situation, ask me a question, please. Last week, we had more people in the room, and there were only two people who are willing to talk to me at this point. Um, and I can fill airtime yeah, as people figure out their audio. But by all means, we had some really interesting conversations at this point, and we have that video available on our YouTube channel as well. If you have specific questions like, wow, what do I do about this tenderness at one side of my lower back? Or how do you handle this situation? I'm all ears. Okay. Well, I am also available by email. So mark at alignathlete.com is a direct way to get in touch with me. If you feel more comfortable conversing through email, I've done a number of consultations that way, and I'm happy to help you. If you're feeling like you're just not getting quite that glute activator technique, I am happy to help you. This is our mission to help people to move and to feel better, and recognize that there are some underlying things with alignment that just help that to be the case. I realized through years in a study group with physical therapists and doctors that I was misaligned and I never even knew it. Even being an exercise trainer and exercising 5, 6, 7 days a week, being in great shape, but functionally things were not perfect. And that's one of the reasons I attribute to every 6 months, 12 months, I'd bend weirdly and my back would go out. And since I've started working on alignment using the tools like the glute activator and the other ones in our prototype phase right now, I've not had an acute incident that knocked me up for 2 days. I'm hoping that is true with you as well. Um, Again, I'll stick around for a couple of minutes if you want to unmute, but thank you for spending time with me at this alignment hour. I think we're good. Thank you.